It's your turn, Wilbina.
Okay. Good morning, APF, and thank you so much for inviting me to share experiences from the Northeast Zone, which is the eastern seaboard from the state of Maine all the way down to mid-Pennsylvania. So I'm going to talk a little bit about public relations and the challenges with internal and external public relations during the pandemic, and also advantages and opportunities stemming from the pandemic. Okay, how to carry the message during the pandemic. All right. Why is public relations important to the PR member? I think that one of the things that we've all learned from this pandemic is that spiritual principles of Narcotics Anonymous encourage us to make Narcotics Anonymous known and respected throughout the community. Also, carrying our message to the newcomer and addicts in the community is the imperative of public relations. So our relations with the public enable us to share this message broadly so that others who might benefit from our program can find us. Now it's not advancing. Okay. So the public relations work that we do with the community is to increase the awareness and credibility of Narcotics Anonymous. And one of the biggest challenges is when meetings closed, many people were assuming that Narcotics Anonymous was not meeting. So sharing our message openly with the public and professionals and developing these relationships with those outside the fellowship is our spiritual aim. So internally, these are many of the challenges that the pandemic created for us. Group spaces closing, groups adhering to guidelines with COVID. I know here in the United States, there are many groups and members personally who were rebellious to maintaining guidelines that facilities had, wearing masks, keeping distancing. And for those reasons, some facilities closed and were not allowing groups to come back. One of the roles that public relations had here was in drafting informational letters for areas and regions to post that and inform members about what the guidelines were, and also what our role in the United States. We have many insurance issues, meetings being insured, whether or not virtual groups were covered by insurance, and how either virtual groups and outside spaces like parking lots were also insured. This was issues and questions that we've had, and areas and regions wondering whether they were still required to submit insurance payments. Another issue had to do with collecting funds through virtual platforms, and also being able to continue with fund flow to areas and regions using virtual apps and trying to adapt with that. So that was a big challenge. Also, another challenge was internal fellowship misconceptions about traditions during the pandemic. So, for example, there were a lot of questions about traditions like anonymity. There's a lot of confusion about that, and public relations needed to step in and answer that. A lot of questions, especially when it came to anonymity on virtual platforms. There were many addicts who had questions about showing their face, not showing their face, identifying with names. A lot of the issues with addicts being resistant to use virtual platforms and then becoming severely isolated, or addicts also meeting in parks or congregating in places, and the question of whether they were calling themselves Narcotics Anonymous meetings because they were not formally attached to a group or an area. So all of these were challenges during the pandemic. Pandemic challenges with the public. Many of our hospitals and institutions and jails were completely shut down or severely curtailed. And many of these committees were also just sitting around dormant and not reaching out to find out if they could come in and what should be done. Also, another big challenge was that paper literature and meeting lists were no longer accepted in institutions. In some cases, you had literature being delivered and thrown away because they were afraid of spreading disease. I know in many cases, because of the overdose death rates that really skyrocketed with the pandemic, in many cases, these were largely ignored because of the focus on COVID. There was no longer a focus on drug-related overdose. So this was also a big challenge in bringing attention to the importance of Narcotics Anonymous and making our meetings available. Here in the United States, liquor stores were deemed an essential service. So while other places like restaurants were closed and other gatherings, I think one of the big challenges was that these particular types of things being offered also created a challenge with the public and the pandemic and the ability to spread our message. So one of the other challenges was also effectively using social media and websites to outreach and get information to the public. I know in some cases, radio stations here were willing in different degrees to make our public service announcements available. So finally, these are some of the advantages and opportunities that the pandemic created for us. So, for example, the opportunities to create virtual presentations to facilities actually expanded. In some cases where hospitals and institutions or jails perhaps, and it has been a disproportionate degree in the United States, but in some cases, facilities were more likely to offer virtual presentations because of the pandemic. Also, many more professionals were willing to meet with us. I know that I do public information locally in the Manhattan area, and we have right now about 4 presentations a month with professionals because they're willing to meet with us on Zoom, and it's very easy to adjust their schedule. So this has created more opportunities. In addition to that, another opportunity is the ability to coordinate virtual conferences that have professionals, corrections, officers, wardens, pastors, social workers, all in one place that enable Narcotics Anonymous to meet with them, not just in our zone, but across the entire country, and to involve international participation. So this is clearly an advantage. And then finally, the ability to coordinate with hospitals and institutions as a subcommittee of Narcotics Anonymous, and also with fellowship development. Because of the virtual platforms, it allows us to work as teams and for public relations, to initiate phone calls, send out email letters, which H&I is usually not used to doing, and then following up and handing off these connections back to the H&I committees or to fellowship development. So I think I've gone like 2 minutes over, and I want to share the time. So thank you so much.
It's amazing work. Thank you. Thank you so much for sharing that, Gulvina. And would like to open question, 1 or 2 questions. Oh, Roger.
So with the number of virtual meetings or hybrid meetings that you might be having, just regular NA meetings, I'm just wondering whether there's also been an opportunity to have inmates from prisons attending more often than they had in the past. Actually, I'm not really even sure how often they may have been able to attend in the past, but I guess I'm just wondering whether that's had any impact on their ability to, and also for you know, that's just in terms of them attending a regular meeting as opposed to an H&I meeting, which might be a different format. But also wondering whether there's been more opportunities for you to have H&I format meetings with inmates since the pandemic, and everybody doing everything on Zoom all day.
Well, I do know that in the state of California, they have set up virtual meetings for parolees with the Department of Corrections there. They have something like 350 parolees attending virtual meetings twice a week. They are special meetings for parolees. The probation officers come in at the very end, and they identify members through their ID numbers in breakout rooms, so they give them credit for attending. Here in the Northeast, they are very resistant. We've actually called the Department of Probation throughout the entire pandemic here in New York. They have not called us back. I think we're going to go in person. But before the pandemic, we did meet with the Department of Probation here, and they were not, they weren't open to Narcotics Anonymous here in New York. They didn't feel that we were an evidence-based program. Also, they're not in favor of our stance with medically assisted treatment and drug replacement therapy. But what our plan is to bring in the probation officer from California in a virtual meeting to explain what's happening in California. That's actually on our list of strategic planning high priorities here in Manhattan. And at this point, it's a matter of getting the Department of Probation in New York to answer us, but it is happening already in different parts of the United States, Arizona and New Mexico, in addition to California. The one other challenge I'm just going to quickly mention is because of COVID, at least in New York, many corrections officers are calling in sick. They are understaffed, and many of the inmates in the prisons are being very violent. So they're also very reluctant to let anyone in. And then we're also not wired for internet in our part of the United States in those prisons. So it's very challenging to get cooperation in that regard.
Next question from Amitabh.
Yeah, thanks, Vilvina. That was, as always, awesome. Just a question. You mentioned that you do 4 presentations a month with professionals. Do you maintain a sort of a FAQ for people who are not yet doing it, so that before you start doing it, you know the kind of experiences that you have gathered because of so many interactions with professionals? So do you have a document that sort of tells us how to go about it? What are the things to keep in mind when you do presentations with professionals? Something like questions and answers to expect. So just an explanation of your experience. Is that available?
Yes, most of the presentations we're doing now, New York City is primarily still closed. And many meetings are not accepting the groups that were there back. So a lot of our presentations now are either to other meeting spaces and professionals to get these places back in. And so we use the standard PowerPoint that explains who we are and what we do. And then we have some very basic questions about what meetings would be doing at their locations. And then the other types of presentations, either to government officials, or it's a very standard PowerPoint. But if I think the other frequently asked questions, they do exist in the handbook, but I could create an additional piece to give to anyone that was curious about that and put it all together.
Yeah, thank you. Thank you.